Hi everyone, good day. Today we are gathered to have this or to conduct this community health seminar about pregnancy-induced hypertension. Sinong may idea what is PIH? So, to all the women present here for today, I am very thankful to have this honor to discuss about PIH. But for today, I am going to focus in one specific topic, which is namely preeclampsia and eclampsia. So, when we talk about PIH or pregnancy-induced hypertension, it is a form of high blood pressure most commonly found in pregnant women. It occurs in about 7 to 10% of all pregnancies in the world. Another form of high blood pressure is chronic hypertension. It is a high blood pressure that is present even before pregnancy. And before we go to my proper discussion, let me first introduce myself. I am Miss Princess Joy Fetilo Sepe, a senior midwife student at Polytechnic State University of Bicol. So, as I am here today, I am invited by your honorable barangay captain and your health coordinator in this barangay to have or discuss about pregnancy-induced hypertension that may complicate the women, especially to those who were pregnant. Because of COVID pandemic, this seminar has been delayed so many times. So we have no choice but to conduct a virtual seminar. Thank you for all who attended for today. And before I start my proper discussion, let's all first watch a video.
While you are pregnant, you will have quite a few appointments to make sure you and your baby stay healthy. One thing that will be checked is your blood pressure. Having high blood pressure during pregnancy can be a cause for concern. If you have high blood pressure during the second half of pregnancy, doctors will do tests to check for a condition called preeclampsia. A combination of high blood pressure readings, urine tests, and blood tests are needed to diagnose preeclampsia. But what is preeclampsia? Preeclampsia is a serious condition that can occur in the second half of pregnancy. It is more common in first-time mums and can be dangerous for both mum and baby. Preeclampsia can cause problems with the baby's growth and can damage mum's kidneys, liver and brain. Scientists have not yet discovered the exact cause of preeclampsia, but we do know that in preeclampsia, the placenta does not develop as it should. Early in pregnancy, the placenta forms from blood vessels and cells to link mum to baby. This connection provides the life source for the growing baby. The placenta provides oxygen and nourishment and removes carbon dioxide and waste to allow for healthy growth. If the placenta does not form properly, the baby may not get the oxygen and nourishment needed. In mum, preeclampsia causes the placenta to release factors that damage the blood vessels throughout her body, leading to high blood pressure. Blood vessel damage can also cause problems in many different organs, such as the kidneys, liver, eyes, and the brain. If preeclampsia is severe, mum may have to deliver the baby early, as delivering the baby in placenta can help improve both mum and baby's condition. You can be on the lookout for the symptoms of preeclampsia. Call your doctor if you develop any of the following: an unusually severe headache that won't go away with medication, abnormal swelling, especially of the face or eyelids, sudden blurred or spotty vision, sudden nausea and vomiting after 20 weeks, or generally feeling very unwell after 20 weeks. However, it is possible mum will not show any of these symptoms. This is why it is important to attend all your doctor's appointments during your pregnancy to allow for careful monitoring, and why research is needed to improve how we care for mums with preeclampsia. For example, some researchers are studying whether certain molecules measured in the blood can be used to detect mums at higher risk of developing preeclampsia. Research is a very important part of the care of mothers and babies around the world. There are teams of doctors, nurses, research scientists and patients working hard to improve how we detect and treat preeclampsia.
So thank you. And after watching the video, let's now start for our proper discussion. My slide is about pregnancy-induced hypertension / preeclampsia and eclampsia. Introduction. Hypertension is one of the most common disorders of pregnancy and contributes significantly to the maternal and perinatal morbidity. Hypertension may appear for the first time during pregnancy as a direct result of the gravid state or a sign of underlying pathology which may be pre-existing. So, when we say hypertension, ito po yung high blood pressure ng mga kababaihan kundi sa lahat ng tao. Pero since nakafocus tayo sa pregnant women due to pregnancy, sabi dito, it contributes daw yung high blood pressure or yung hypertension to the maternal and perinatal morbidity. So, nakakontribute siya sa kadalasan na ganong sitwasyon. Next. Classification of hypertension in pregnancy. So, pregnancy-induced hypertension with proteinuria and or edema, which is pre-eclampsia and eclampsia. Without gross edema or proteinuria may be called gestational hypertension. But for today, ito nga, po-focus tayo sa with proteinuria and or edema, which is pre-eclampsia and eclampsia. So, the definition for pre-eclampsia is a multi-system disorder of unknown etiology characterized by development of hypertension to the extent of 140/90 mm of hexagram or more with proteinuria induced by pregnancy after the 28th week in gestation in a previously normotensive and proteinuric woman. It is based on the International Society for Study of Hypertension in Pregnancy on 1998. So, the incidence, according to the new guidelines given by American Congress of Obstetricians and Gynecologists in 2013, in India, the incidence of preeclampsia is reported to be 8 to 10% among the pregnant women. It occurs more frequently in young primigravidae or first-time mother that is over 35 years of age. So, may I know among these participants whom is first time pa lang nilang magbuntis, primigravidae. Okay, so madami-dami din. So, mas crucial sa inyo na malaman nyo kung ano yung dapat nyong gawin when taking care of your own health, especially ngayon na buntis, and not only to keep you safe, but also your baby. Okay? It is known to be associated with high datiform mole, multiple pregnancy, and maternal diabetes. So, hindi lang siya sa high blood na kakaroon din ng association or ng complication, lalo na sa mga pregnant women na merong diabetes. The incidence in primigravidae is about 10% and in multigravidae is 5%. So, mas madami yung chance na nagkakaroon ng ganitong cases ng preeclampsia sa mga first-time mother rather than the multigravidae o yung mga second or third time na nilang magbuntis. Ayan. This is the illustration for preeclampsia pathophysiology. Okay. Next. There is a mild and severe case of preeclampsia. When we say mild, this includes cases of sustained rise of blood pressure of more than 140 to 90 mm of hexagram but less than systolic or 110 diastolic without significant proteinuria. So, without significant proteinuria, ibig sabihin, pagkatapos nyo mag-undergo ng urinalysis, wala masyadong nakuha or nakita na protein content sa inyong urine. So, it is only a mild case of preeclampsia. And, i-base din siya dun sa high blood pressure nyo. Yun nga, sa diastolic and systolic pressure. And we can say that it is severe when the systolic blood pressure is of more than 160 mm hexagram or diastolic more than 110 mm of hexagram. So, kung mapapansin nyo, ang mild at severe case ng preeclampsia are all a sign of high blood pressure kasi ang normal blood pressure natin is 110/80. Next. Clinical features. The clinical manifestation appears usually after the 28th week of gestation. So, kailangan siguro 28th week, mga 4 months, 5 months ng buntis ang mama, ang isang mother. The onset is usually insidious and the syndrome runs a slow course. So, hindi agad-agad nakikita or namamalayan yung syndrome or yung symptoms. This is the illustration for the non-pregnant. Ganyan ang sistema kapag hindi pa buntis. Sa gitna is the mother with preeclampsia. Pansin nyo. Then, the right side is for normal pregnancy. Okay. Mild symptoms. Slight swelling over the ankles from rising from the bed in morning. Yan yung kadalasan yung mafe-feel. Tightness of the ring on the finger. Swelling may extend to face, abdominal wall, vulva, and even the whole body. Ayan yung symptoms na mararamdaman nyo. Slight swelling, so medyo pamamaga sa ankle nyo, lalo na pag bangon nyo sa umaga. Alarming symptoms of preeclampsia is that headache, disturbed sleep, diminished urinary output, epigastric pain, and eye symptoms. Investigation. So, kapag naka-feel nyo na yung mga symptoms, ito yung kadalasang ginagawa. There will be history collection, physical examination, urine analysis. Proteinuria is the last feature of preeclampsia to be appear. There may be few hyaline cysts, epithelial cells, or even few red cells. Ophthalmoscopic examination, blood values or CBCs, liver function tests, non-stress test or biophysical profile, then renal function test. Ayan. Urinalysis then, blood pressure checking. Then for the management, so as long as the etiology of preeclampsia remains obscure, the treatment is mostly empirical and symptomatic. Pag sinabi natin symptomatic, yung nakipansin natin yung symptoms. Pharmacological management. So ito yung mga gamot na tinitake or pinapainom ng doctor or ng midwife ng OB nyo kapag merong onset ng preeclampsia. First is antihypertensive agents like metildopa, central and peripheral antiadrenergic. The action should be 250 to 500 milligrams. Labetalol, adrenoceptor antagonist, 50 milligrams. Anti-beta blockers yan. Nifedipine, calcium channel blockers, 10 to 20 milligrams only. Hydralazine, vascular smooth muscle relaxant, 10 to 25 milligrams only. And sedatives. Sedatives may be used to cut down the emotional factors. Mild sedatives may be given orally as phenobarbital, 60 milligrams of it, or diazepam, 5 milligrams at bedtime. Next. Surgical management. Depending on the response to the treatment, the patients are grouped into the following. So there will be Group A, B, and C. Group A is a preeclampsia features completely subside, so pawala na. Group B, partial control of the preeclampsia features but the blood pressure maintains a steady high level. So Group B daw, ito yung nagko-control during preeclampsia kapag yung blood pressure ganun pa din kataas, na maintain siya in a specific interval of time. Group C, persistently increasing BP to severe level. Methods of termination. So, first, induction of labor and 2 cesarean section. So, kung mapapansin nyo, ang methods only to terminate preeclampsia is to deliver the baby. Kailangan mailabas agad yung baby. Next. So, management during labor. Blood pressure tends to rise during labor and convulsions may occur. The patient should be in bed. Antihypertensive drugs may be given. Blood pressure should be monitored along with urinary output. Careful monitoring of fetus also. Ito yung ginagawa kadalasan kapag nanganganak na yung isang mother. Puerperium, the patient is to be watched closely for at least 48 hours, the period during which convulsions usually occur. Nursing management. Continue monitoring of vital signs po yan. Rest, ayan, position, diet, and fluids of the patient. Prediction and prevention. Paano nga ba malalaman, mahulaan na meron kang preeclampsia and paano ito maiiwasan? So, screening test is conducted for prediction and prevention of preeclampsia are not helpful. The following steps that helps are, so dito, sinasabi na hindi sapat ang screening test lang. So, kailangan sundin din itong mga sumusunod. Ito, ang regular antenatal check-up for early detection, antithrombotic agent, calcium supplementations, antioxidants, and nutritional supplements. Ito yung mga kailangan i-take as well. Kailangan daw ng regular na check-up for early detection. Complications. The complications may be considered are more likely to occur if the patients are left untreated from the following points of view. For immediate, sa mother, maternal, ito, eclampsia, accidental hemorrhage, oliguria and anuria, dimness of vision, even blindness, preterm labor,
HELLP syndrome, shock, and sepsis. For fetus naman, immediate intrauterine death, intrauterine growth restriction, asphyxia, and prematurity. So, ito yung maaaring maging immediate complication sa mother and sa fetus, sa baby. Remote complication will be residual hypertension, recurrent preeclampsia, chronic renal disease. So, that's the end of my presentation from my PowerPoint. Is there any question? Okay, so as per instructed by our health coordinator in your barangay community, there will be a evaluation given to all the participants. Ipapasa. So, kailangan i-check yata nila yung attendance. Then, ibibigay sa inyo. Isi-send mismo sa bahay nyo yung evaluation form about sa seminar natin ngayon. And then, dun pwede nyo na ding ilagay yung comments or questions nyo, suggestions about our topic. And before I formally end my discussion, just like how I start my presentation, let's all first watch a video.
Did you know that the risk of preeclampsia doesn't end even after you've had your baby? Postpartum preeclampsia is a serious condition related to high blood pressure that may happen within the first week or so after delivery, whether or not you had preeclampsia during your pregnancy. But can also happen any time during the first 6 weeks after you've had your baby. It can be very dangerous for the mother. As postpartum preeclampsia can cause seizures, organ damage, and stroke, it can even be fatal. It can quickly progress to severe preeclampsia, eclampsia, or HELP syndrome, a severe form of preeclampsia. So it's important to be able to recognize the symptoms of postpartum preeclampsia and know what to do if you experience any of them. If you were told to schedule an early follow-up appointment due to high blood pressure while at the hospital delivering your baby, it is important to keep this appointment, even if you're feeling okay. Symptoms of postpartum preeclampsia vary, depending on how severe they are. Take these actions to protect yourself. Call your doctor or healthcare provider right away if your blood pressure is 140/90 or higher. You have a headache that won't go away. Your vision changes or your eyesight becomes blurry. You have stomach pain, swelling in your hands and face, or you're nauseous and throwing up. If you can't reach your healthcare provider, have someone take you to the emergency room or call an ambulance. Now, for more serious symptoms, such as your blood pressure is 160/110 or higher, you experience shortness of breath or trouble breathing, you see spots or have other vision changes, you have a seizure. These symptoms are very serious. Call 911 or have someone take you to the emergency room right away. When reporting your symptoms to the hospital staff, tell them you've recently had a baby. Notify your pregnancy doctor or midwife that you're at the hospital. Have your blood pressure taken and request to see an obstetrician or OB within an hour of your arrival. If your blood pressure is higher than 140/90 and you have other signs or symptoms, you may be diagnosed with postpartum preeclampsia. Once diagnosed, you may be given medications and may need to stay at the hospital. So having someone who can help with the baby is important. You should only be sent home after your blood pressure has come down to lower than 160/110. After returning home, you should follow up with your doctor within a couple of days. They will make sure your symptoms have improved and that your blood pressure is okay. They may also discuss your medications and how long you will have to take them. If you have had preeclampsia, it may be the first sign of long-term blood pressure concerns needing ongoing care. Make sure to tell all future doctors about your preeclampsia history, especially your OB or midwife if you get pregnant again. So remember, whether you've had high blood pressure during pregnancy or not, you're still at risk for preeclampsia even after you've delivered your baby. It's important to listen to your body, trust your instincts, pay attention to your health, and seek medical help whenever you feel that something isn't right. Always stay alert. It can save your life.
So, yon. Tapos na yung discussion ko about pre-eclampsia and eclampsia using my very short and brief PowerPoint. So, for you, to all the mothers present here, to all the pregnant women, and sa mga kababaihan na tulad ko na nandito ngayon, na nakinig about the discussion of pre-eclampsia and eclampsia, which is a part of PIH or pregnancy-induced hypertension diseases or complications. We have given you earlier a brochure or IEC material like this. Here. Ayan. So, paki-check na lang po. Then, this one. Ayan. So, thank you once again for inviting me to be your discussant or to be your speaker about PIH or pregnancy-induced hypertension, as well discussing the specific topic about preeclampsia and eclampsia. So, I hope mommies, sa mga beautiful women here, katulad ko, let's all be healthy and safe always, lalo na hindi na tayo nag-iisa. We have this responsibility to take care of our family, especially to our baby. So, thank you and God bless. Stay safe.